Mr. Speaker, the recent news that Clinic 554, a community-based healthcare clinic in Fredericton, will be closing due to financial difficulties is unacceptable. These difficulties are a result of regulations under the Medical Services Payment Act, which restricts funding for abortions provided outside of hospitals. This regulation is in violation of the Canada Health Act, which states that abortions are a medically necessary procedure. 25 years ago, the federal government ruled that provinces must fully fund medically necessary procedures. New Brunswick is the only province in Canada which is not funding an abortion clinic within its borders. In May, the Minister of Health said he would investigate the situation and get back to me. He's had 6 months to do so. So will the Minister of Health remove the restrictive Schedule 2 of Regulation 8420 of the Medical Services Payment Act to ensure abortions are covered in the community in clinics such as Clinic 554?
Le ministre de la Santé.
Well, Mr. Speaker, I've heard a lot about this violation of the Canada Health Act, and I'm fairly familiar with the Act. I've read it. My predecessor, the member of for Kent South, previous members of the Gallant government have reviewed the same thing that I did, and I wonder if the member would be kind enough to tell me, for my personal edification, the section and subsection of the Canada Health Act that we are in violation of. I asked the question quite sincerely. Very often people say, well, you're in violation of the Canada Health Act. Canada Health Act is a big statute. I've read it. It has a number of issues on health, not in healthcare. It's a funding statute. And I hear this a lot, and I wonder if you could tell me the specifics of the act that this government and previous governments have been.
Mr. Speaker, the 2017-18 Canada Health Act annual report states the lack of coverage for private clinic abortions under the New Brunswick Provincial Health Care Insurance Plan remains a concern under the accessibility and comprehensiveness criteria of the Canada Health Act. Last week, the Health Minister asked me to specify which section of the Canada Health Act New Brunswick is not complying with by refusing to fund abortions at Clinic 554. Section 9 of the Act says, in order to satisfy the criteria on respecting comprehensiveness, the healthcare insurance plan of a province must ensure all insured health services provided by hospitals and medical practitioners. Paragraph A1 of Regulation 8420 under the Medical Services Payment Act exempts an otherwise insured medically necessary service, abortions, from being insured. This fails to meet the comprehensiveness requirements under the Canada Health Act. Successive governments have chosen to discriminate against those who need this service. I call on the Minister of Health to show leadership and end this practice. Thank you.